Once again from DPL Surveillance Equipment. It's another lovely morning, believe it or not, in sunny Southern California, specifically Camarillo, California is where we live. I think it's going to be a very nice day today. The birds are chirping. Somebody has some breadcrumbs on the ground for the birds. Just everything looks very, very nice. A good day to get out and about, get some fresh air, get some sun, relax and take it easy. That's what we're going to do. Spend some Bitcoin, stuff our faces, preparing for a trip coming up soon. Don't want to say where or anything specifically. You'll find out when we post the pictures on my Facebook page probably. So how you guys doing? Hope everything is going well for you. Anything current in the economy? Let's see, that I can think of. Let's see, before I forget, as a lot of you guys know, I'm always concerned about a slowdown in the economy. You know, if the economy is booming, that's good. And if we get a recession, you got to be prepared. You don't want to be caught off guard at the last minute. So you may want to consider whether or not it's a good time to buy that new house, a good time to buy that new car, unless you're financially prepared. But if you think your finances and such could be affected by a recession or a slowdown, then you want to postpone major purchases. If you're prepared, you got enough cash set aside and the savings and all of that, you're doing fine with the retirement money set aside, then of course it's a good idea to go out and purchase property, other assets, whatever, at what could very well be, excuse the noise. When you purchase assets at this kind of prices, that's smart, that's a good thing. But if you don't have much cash set aside for emergencies and your retirement money, somehow it has not been making it into your retirement account, and your savings account and everything is low, then you may want to hold back. Because I think when you have a recession, it's usually not a good thing as far as its effect on your finances. So try to keep that in mind. Okay. What else is going on? Oh yeah, Google. Before I forget, Google and Amazon, two of the biggest names in the tech sector. They've been reporting slower sales, sluggish sales, again, coming out of Google and coming out of Amazon. Normally wouldn't be such a big deal, but when you combine what's going on with Google, when you combine what's going on with Amazon, in addition to Netflix, in addition to Facebook, in addition to IBM and BlackRock, all these major companies, Caterpillar, when they start talking about slowing sales across multiple sectors and multiple industries, housing sales and starts down, bank stocks taking a big hit, all these things combined together, that's the problem. That paints a picture that's not so rosy for those of you who are at or near retirement. You don't want to be in a situation where you're taking money out of your retirement accounts in an attempt to retire what seems like the wrong possible time, the worst possible time. That doesn't go over very well. So just be cautious, because it seems like there's a number of signs that things could be headed south in a very, very short term. Okay, and it could be protracted, of course. So anyway, just keep that in mind. Okay. Now, my name is Monty Henry, owner of DPL Surveillance Equipment. We run a full-service surveillance and security equipment company. We have lifetime guarantees and warranties on all the products, 24/7, 365 text, sales, and customer support. We are perhaps the largest inventory of items that not only can you buy, but you can rent as well, rent or lay away as well. We have an extremely large video library. I think our video library and articles and the podcasts and the blogs, all of this is in the media center. Those things, we have the largest collection of information, probably bar none, mainly because we're adamant about pushing education, whether it's in the health and fitness areas, our category on our website, whether or not it's the cybersecurity related section, whether or not it's the cryptocurrency and blockchain related categories, whether or not it's in surveillance and counter surveillance, you name it, we're covering it, and the miscellaneous category as well is huge and growing as well. So read the articles, the blogs, the podcasts, take a look at the demonstration videos and all that stuff, and see if you can get something out of it. And don't hesitate to comment. We're getting a good amount of commenters now that are commenting on the various articles and such. So that's something we look forward to. We look forward to the feedback. We want to have a discussion. We want to have a dialogue with people about the real issues that are going on. Okay, we do accept Bitcoin, Litecoin, and Ethereum in the shopping cart. And so you crypto millionaires, don't hesitate to patronize our website and drop some of that crypto wealth on us. If you know, you guys, a lot of you, like I am, me and my wife, we got in early, got a chance to experience some substantial gains, and so you know, like I know, it shouldn't be a big deal dropping some of that crypto wealth on us. Besides, we want to poke the finger in the eye of the MasterCards and the Visas, right, and American Express and the Discovers and all of those guys. J.P. Morgan Chase, there was a crooks over there. In addition to Bank of America, Wells Fargo has a scam going on at any given time. There's a write-up in the papers talking about what Wells Fargo. They're always in the news. If it's not fake account creation, it's selling insurance services, pet insurance or something that you don't need, or it's who knows, manipulating. Also, what were they doing? Their wealth management people are upselling products that those customers don't want or don't need. American Express and Wells Fargo were caught with their foreign currency exchange business. When you go on trips and stuff, like a lot of times you work with American Express or Wells Fargo, some of these banks, in terms of them handling your currency exchanges and stuff like that. A lot of customers have been finding out that they've been ripped off. American Express is settling their lawsuit as we speak, as far as what they've been doing on the topic of foreign currency exchange. But you name it, it just goes on and on and on with these banks and these financial institutions. The merchant processing fees are astronomical, and they're taking away more revenue, more financial resources from the retailers and the merchants like myself. So that's why we want to make the transition to Bitcoin and cryptocurrencies as soon as possible, so that we can save more money, pass it along to the customers. Customers keep more money in their pockets, and let's get rid of this arbitrage or these shackles that they're putting on us in the financial industry. Financial oppression should be a thing of the past right now, you guys. We have a choice, so make sure you take advantage of it. Satoshi Nakamoto gave us a fantastic, innovative creation in Bitcoin and blockchain and such, so we don't want to take it for granted. Somebody gives you liberty, you don't just take it for granted. Hopefully you defend it with everything you have. What else? The website is completely redesigned. We're constantly tweaking things, going over it. When you patronize our website, take a look around, let us know about the functionality and the design and how quick it is or responsive it is or not. And if there's something we can fix or address, let us know so we can get on top of it. Other than that, let's get into this article. This article is pretty interesting, I think. I'm going to put it under the category of health and fitness. Our health and fitness category is expanding. We try to keep it up to date with new current articles and information all the time. This one has to do with Trump's proposed solution for high drug prices. Now, the reason why I put a lot of emphasis on proposed, let me get away from this noise. The proposed solution is basically an experiment. Okay, I'm going to read the details, but I might as well give you a teaser. Okay, alert. This proposed solution is only a proposed solution and an experiment that takes place between 2020 and 25. So for 5 years, these guys are going to experiment with one manufacturer, one very narrow segment of the pharmaceutical drugs products where they actually sell things. The specific category is going to be biologics, and it's going to be only pertaining to Medicare Part B. And again, one manufacturer, one classification of drugs, not the broader categories that are typically more commonly sold through pharmaceuticals stores or pharmacy stores. So it's very limited in scope, unfortunately. And let's take a look at the specifics, so you know, like I know what I've learned, and then you'll probably say to yourself, this doesn't seem to be as so impressive when you read the details, as it usually is, especially when listening to Donald Trump. This article is entitled, Trump Offers Test Plan to Lower Medicare Drug Costs. Again, Trump offers... We got a little bit of noise again on this direction over here, too. Just a second. Trump offers test plan to lower Medicare drug costs. Okay, now it's coming this way. Hold on. Okay, let's see here. Going. Almost gone. That's a little bit better. Okay. Trump offers test plan to lower Medicare drug costs. Under proposal, some drugs would shift to prices closer to those in other countries. President Trump on Thursday offered a plan to drive down the price Medicare pays for some drugs, a move that could save taxpayers billions of dollars, but also faces resistance from the pharmaceutical industry. The approach would test a plan to lower costs for some drugs over 5 years by basing them on their costs in other countries. It marks a push by the administration ahead of the November 6th midterm elections to challenge assertions from Democrats that it has done too little to tackle high drug prices. This is a revolutionary change, said Mr. Trump, who outlined the proposal in remarks at the Department of Health and Human Services. No one has had the courage to do it or just didn't want to do it. Now, I have to put emphasis on the idea that the midterm elections are coming up because, see, a lot of politicians, they want to drum up some issue, right, to get everyone excited. And I think because the Trump administration hasn't really done a whole lot in the way of reassuring people that they're addressing this health care-related reform or repeal of Obamacare. That system was supposed to implode all on its own, but they've been putting a lot of effort. The Trump administration has put a lot of effort to sabotage it and to cause it to implode. But unfortunately, they've been, in doing so, they've been expending a lot of time and resources trying to dismantle a system, that particular Obamacare system, and without coming up with a suitable replacement. So, one, you don't take something and dismantle it and get rid of it completely when you have 21 million people relying upon it, and then not replace it with something as significant that's going to allow 21 million people to make a smooth transition over to your newly created health plan, whatever that is, without too much disruption. But as far as I can tell, it doesn't look like they have a credible alternative. I'm hearing about skinny packages and and healthcare plans that don't offer much and don't last very long or something, but I don't know if they have a suitable replacement. Anyway, this idea of tackling high drug prices seems to be an interim step towards getting people at least excited about something until you read the details, which we're going to get to right here. The proposal wouldn't likely go into effect until 2019 or 2020, and would cover only some drugs in Medicare in parts of the country. Some Democrats said the idea would do little in the short term and would fall short of Mr. Trump's more aggressive campaign promise on drug prices. So again, if you have Medicare and if you have Medicare Part B, and if you live in a certain part of the country, maybe you'll get some benefit from this. If not, then of course you don't benefit, right? So that's one problem. There are two problems anyway. Under the proposal, the Centers for Medicare and Medicaid Services would issue a proposed ruling this spring to change how it pays for infused and injected drugs administered by physicians in half the country. The changes would only apply to some drugs in Medicare's outpatient program known as Part B, and not the most commonly used medicines sold at pharmacies. So again, what Trump calls a very revolutionary change seems to only be applicable to some drugs, the Part B portion, and not even apply. It doesn't even apply to the most commonly used medicines, so they're pharmacies. So I'm not quite sure how revolutionary this is right now. Moving right along, Medicare spent $28 billion on drugs used in Part B in 2016, up 59% from $17.6 billion in 2011. CMS said in a statement, the agency said its planned experiment will reduce spending on the drugs by about 30% and save seniors money by lowering their coinsurance payments. The only good thing about this is that that $28 billion figure is a substantial figure, and if they can save anywhere with a good amount of what they spent in Medicare, which was $17.6 billion in 2011, all the way up to $28 billion in 2016. If any of that can be reduced substantially, then that's a good thing, right? So we'll keep our fingers crossed on that part. But again, remember, it's the big picture that we're concerned about. Moving right along, compared with the U.S., drug prices are far lower in many overseas countries. In Europe, governments directly or indirectly control their costs. And in some cases, the National Health Service buys drugs and sets a price that manufacturers must meet to sell their product. The U.S. prices are set on the open market and through negotiation by insurers and hospitals. The proposal aims to strong-arm pharmaceutical companies into lowering prices for some of the highest-cost drugs in Medicare. But it is set to face heated opposition from the pharmaceutical industry, which has said it relies on U.S. spending on its drugs to fuel innovation and research. So again, the pharmaceutical industry right now is not totally on board with this. Remember, they spend a lot of money lobbying in Washington, and their special interest groups have tons of money. And, if they feel like the bottom line is going to be impacted by this new proposal, they would fight back. And that means spending a lot of money, obviously, on the opposite party as compared to the party that's proposing the changes, right? And you always want to follow the money on this, you guys. Pharmaceutical stocks rallied right after Trump made this announcement, which basically means that no one in the pharmaceutical industry, the investors or the manufacturers, are concerned about this proposed revolutionary change. So remember, it's always a matter of follow the money. If the stock market, if the investors indicate that this is not a problem, it's basically a snooze fest, then that's what it is. It's not really going to impact or change anything according to the way the stocks are behaving. Moving right along, adopting foreign price controls on American innovation puts America's patients last and diminishes their hope for a better future, said James C. Greenwood, chief executive of the Biotechnology Innovation Organization, a drug industry group whose members' sales rely on Medicare Part B. And this is probably the most stupid form of BS you can imagine. It says America's patients puts America's patients last and diminishes their hope for a better future. They're basically saying if you don't use our drugs and take our drugs, you won't have a better future. I think that's going a little bit overboard, mainly because some of us, like myself, we have been drug-free from pharmaceuticals and medical drugs for most of our lives. Only within the very recent future, very recent times have I ever had to take medicine. Okay, but for the most majority of my life, 90%, I have had nothing to do with it. Had no reason for it. So I think that to say this somehow diminishes the opportunity to have a bright future for a lot of people, they may be overplaying that. When you look at the side effects, when you look at the costs and all that, a lot of people they get on these medications. That's what the word I've been struggling with. When you get on medications, a lot of times what you're dealing with is the side effects of medications. After a while, you're so impacted by side effects that trying to get off of it is a major issue. Okay, so we don't want to pretend like our life would never be anything significant unless you get medication. I think we need to put this in proper perspective. Anyway, pharma, in this case spelled PHRMA, this is a trade group representing large pharmaceutical companies, said it had serious concerns with any changes to Medicare Part B that threaten patient access to life-saving medicines, undermine physician care quality, or discourage continued medical progress. HHS Secretary Alex Azar said drug makers are always free to raise the prices they charge, and other countries are focused on reducing inefficiencies in their operations to make up cost differences. Mr. Trump has called other countries freeloaders, saying they're reaping the benefits of U.S. drug innovation or paying far less. I think that's kind of important, that part about wringing out inefficiencies and charging more in other countries. So any corporation, any company, it's always a given that you always have to take a look at your operation, and the pharmaceutical industry is no different. Are you wringing out as much as possible in the way of inefficiencies out of your operations? Are you saving money in every possible way you can? Are you getting the most out of productivity everywhere you can? Are you pricing your product particularly overseas, if that's the case, high enough to so that they're also offsetting a lot of your costs? There's no reason why some countries, a lot of countries outside the United States, should be subsidized by high drug prices in the United States. That applies to not only drugs but anything else, car manufacturing, TV sales, whatever. You always want to see if you can not disadvantage some customers to help other customers. So, moving right along. The proposal drew mixed reactions from lawmakers and consumer advocacy groups. Some derided it as a public relations effort to drum up voter support for Republicans who have been looking for a winning message on health care before the midterms. So again, this really hits home to the point of the Republicans have been a terrible job having a meaningful discussion on health care reform or whatever plan or solution that they're trying to come up with. So the idea that they have an experiment lasting 5 years that only applies to a certain manufacturer, that only applies to biologics, that only applies to a certain part of the country, that only applies to a very narrow slice of drugs that are sold, not even the most commonly sold, as the article mentions, in pharmacies. You're not really doing anything revolutionary. You're just basically coming up with a dog and pony show that's going to get people excited when they hear your soundbite. But as you can see, as I've learned, that when you read the details, it looks totally different. Okay, moving right along, the Trump administration has concocted a dog and pony show to trick the American people into thinking they are taking real action to lower drug prices. They are not, said Senator Ron Wyden, and I agree with him 100%. If Trump really believed in this proposal, he would have made it permanent. He would have put it into effect with Congress's approval or whoever, and they would have fixed this like Obama tried to fix Obamacare, and it would take a lot of effort to undo it. Okay, Trump knows that when you're serious about something and committed to something, you go all in on it. You don't do a very limited market test for a very short period of time with a very short narrow of products that you're actually impacting, for a very small sliver of the population and a very narrow sliver of the country. So a few things wrong with this approach. Republicans, however, praised the proposal. Tennesseans often struggle to afford prescription drugs, and this proposal appears to put patients and taxpayers first, said Senator Lamar Alexander. Well, I think he's deceiving himself, this Mr. Alexander, definitely. The U.S. experiment would last from 2020 to 2025 and would only apply to certain drugs made by a single manufacturer and those known as biologics, which are made from living organisms. The federal government, as part of the proposal, would also look at having vendors negotiate prices instead of doctors and hospitals, and paying doctors a flat fee for administering medications instead of a percentage of the purchase price. Under current policy, doctors' practices and hospitals buy outpatient drugs and then bill Medicare for reimbursement. The government pays doctors based on average net sales price data submitted by pharmaceutical companies for each drug, plus an additional 4.3% of the sales price. Critics have long held that the percentage-based add-on fee create incentives for doctors to use higher-priced drugs, a concern that CMS cited Thursday. CMS said it would test ways to replace the percentage-based payment with a fixed fee that would remove incentives to prescribe higher-cost drugs without reducing overall payments to doctors. I think whoever devised the idea of doctors making a percentage of anything has to understand that in a field where you have generics, you have equipment and procedures that are just as good as the higher priced solutions. You always have to keep that in mind, okay? There's no reason why doctors should have any incentive to push one pill over another simply because the first one is a higher price one that I can make a lot of money off of versus a generic or something that's lower price and that I don't make as much money off of. But at the same time, they're both equal in quality, and the patient can realize a huge savings, not to mention the insurance companies and such. So whoever devised that knew full well what they were doing as far as giving doctors any incentive to push something that's higher in price as compared to something that's still competitive and just as good quality at a lower price. So definitely that's an area that needs to be looked at. So the CMS hopefully will revamp this, the way this is implemented. But you got to look at the long term of the big picture, you guys. This experiment, admitted experiment that's going to just take place over a 5-year period, only applied to one manufacturer, and it looks like biologics is the main area. It looks like most over-the-counter pharmacies won't be impacted at all. It looks like the pharmaceutical industry has a lot of clout, a lot of financial resources, and they can very well contest this. But again, judging by the way the pharmaceutical stocks rallied, the day of the announcement indicates to me that this is nothing. This is not really going to make a big difference. Okay, even though there's a substantial amount of money that Medicare is spending, I don't know if this proposal has a lot of teeth, put it that way. So anyway, I'm going to highlight the details so you guys can see whether or not you live in a certain part of the country, whether or not you use biologics, whether or not you use Medicare Part B, whether or not you're purchasing most of your drugs outside of pharmacy stores and such, because this is so narrow in scope that I get the impression that a lot of people aren't even going to be able to reap the benefits. It's just too many restrictions, too many conditions, as far as I can tell. And besides, by the time the marketplace gets a hold of a change like this, that's this large in scope, if it were larger in scope, the marketplace takes time for the marketplace to properly adjust to it. And by the time this experiment is implemented and it gets underway, it'll be over with. It'll be done. Okay? There won't be anything else to even think about because the experiment will be over. And the midterms will be over. And who knows, Republicans will be in office, or Democrats may be in office, and no one would even think back and remember this proposal because the elections will be over. So anyway, as I like to say at the conclusion of every podcast, you guys keep your eyes and ears open and stay safe out there. Have a good day. Bye.